Hi, everybody. I'm Tony. I'm the outreach coordinator at AMI-Quebec, and I'm here with Carole-Anne and Lynn, who will introduce themselves in a second. We're going to talk to you tonight about effective communication with your healthcare provider. This is a interactive live broadcast, so if you have questions or comments, put them forward. Mark is over there manning the computer, and he will be putting your questions and comments on the screen so we can answer them as efficiently as we can. So we'll get right into this and have everyone introduce themselves, tell us what you do and who you are.
Hi, my name is Carole-Anne. I'm a resident in psychiatry, and maybe I could explain what a resident is, because you might meet us in the hospitals. But basically, we finished medical schools, so we're like junior doctors, and it just means we work with supervisors, which are the staff, and they are more experienced doctors who finished residency.
Perfect. And we have Lynn.
And I'm Lynn Harris. I am a family peer support worker for AMI-Quebec, and I work out of the Jewish General Hospital and all of the psychiatry wards. So I service the needs of family members who have a loved one who is challenged with mental illness.
All right. Thank you. So we're going to jump right into this. I've got a list of questions here that I'm going to kind of ask you both, and we're going to get your opinions and input, and it's going to be we want this to be a conversation. So, if something comes up that we want to talk about, we can talk about it. There's no strict things. I did a Google search right before this and to prepare, and the first thing that came up on every website that I saw was to make a list. Now, everyone says make a list, make a list, make a list. What kind of things do you think patients should be putting on this list before they go talk to a doctor? Because make a list, but no one says what to put on that list.
So one of the first things to put on the list would be symptoms. And if you could start a few days before the appointment to look what symptoms you have and which one are most important to you and which one you want to discuss. Questions are important too, because it's easy to forget when we are doing the appointment. So if we have them written down, it's easier to remember. And I would add medications, what you are currently taking, what you tried, and this includes all herbal remedies as well. I count in medication.
Making a list is hugely, hugely important. And the list really comes under it when I talk about what do you want to do to talk to the medical personnel, we talk about prepare. And P is the planning. And that's where the list comes in, plan. In addition to all the things that we're saying here, one wants to think about, what do you want to come out of your appointment? What are your questions? What is making you uncomfortable, and how would you like to feel? So what would you like to have happen? And I also work with family members, and that becomes a big question is, how can I speak with the medical personnel? What can I do? And the first thing that I tell them is sit down, put your thoughts together, and ask, how do you want to be implicated in your loved one's treatment? And what can you do? What you are allowed to do? What role you can play? And ask the doctor with your list. Don't start going overboard and asking a gazillion questions over. Think about it and put it small.
So then you brought up a good point. A lot of times people will go with family members to a doctor's appointment. They'll bring a family member or a friend to kind of either help them or just as a support. I have a few questions around that. We live in Quebec. It's a very cultural city and province. What do you do if your main patient does not speak French or does not speak English or just doesn't speak the same language as the doctor? How can that work in the office? Are there things that they can do in advance? Are there options that they have in the hospitals if they're in a hospital? Do you guys know of anything that we can do to work around that?
So I know in hospitals there are translators. We do need to take an appointment with them.
Okay.
So if the patient is hospitalized, we could call a translator, and the translator would say, "Oh, I come tomorrow at 1 p.m." So we could meet the patient with the translator at 1 p.m. the next day. So this is something we can do in the hospitals. There are some CLSCs where they have translators available over the phone as well.
Okay.
But in a outpatient office setting, I'm not sure if this is something I'm sure we can organize an appointment with a translator, but I don't know how easy that is.
I'm with you. And it's quite difficult. In my experience, when people have asked, it becomes a difficulty. It's a challenge, and it adds to the challenges that families and patients face. It should not be insurmountable, but planning it, preparing for it, is truly helpful. The frustration, of course, comes when we're in crisis situations, where a lot of my work is in the ER. And in that case, family members are the ones that are relied on, although it might not be the most beneficial way to do it. It is the way that it often happens.
All right. So whenever possible, it's part of planning for your doctor's appointment is trying to make sure that you have someone there that can speak the language, whether through the doctor's office or through your family. Okay. Back to families again. If someone has a family member in the room with them, how does that work? Is there, how can that family member support the patient but also respect that privacy between the patient and the doctor?
Usually at the Jewish General Hospital, the patient will be interviewed by the doctor and the residents and whoever the team is, separately from family members. Family members are often interviewed, not always, and that's because of the legalities of it. A family member can only be interviewed, can only be part of an interview with a patient if the patient wishes. Okay. And that's not always the case. And at the same time, though, family members are going through their own challenges dealing with a loved one with mental illness, and so it becomes a difficult situation, and those are the family members that we here at AMI help a lot.
So I like what you're saying with because I really like meeting family members whenever possible because it's really helpful. And what I usually do is I meet the patient alone first, and then I ask them if I could meet their family members, and then I meet the family members alone, but not to discuss what the patient told me because this is confidential. It's really to receive information from them, and then I like to do a meeting with everyone, like the family members, the patient, and myself, so everyone is on the same page. Always being careful about about respecting the confidentiality of the patient because this is important as well. Okay. But information from family members is really because they know the person, they know them better than anyone else.
So in a situation where, let's say, a family member or a friend is the primary caregiver, how would that be balanced out? Where they're the person giving the treatments, medication, following up, doing the stuff like that. How does that work when you're having that interview and in that conversation?
So I would be interested in knowing like what the caregiver noticed, how is it going with the medications, what are the difficulties, the challenges, what makes the treatment hard to follow, or how the person improved. And I would like to know all of this from the patient as well to compare and understand better.
I love what Carole-Anne is saying, and what she's implying is that there be continuity both with the patient and the family member. And that is what family members really want, the ones that I see for sure. And I think that's what causes a lot of family members a lot of frustration when it doesn't happen like that. And so that actually brings us right back to that planning part, the make the list. So the next appointment, the follow-up appointment, you as a family member can create the list answering all of those questions that Carole-Anne just gave you. What symptoms are you seeing? What changes are you seeing in your loved one? What, in terms of their eating and their sleeping and their activities of daily life, not just the medical appointment, the medical things that we wouldn't necessarily know as a family member, that their stomach's upset or that they have a headache, or those things the patient reports, but there are things that we family members learn and know, and those are the kinds of things that can help you in your planning of follow-up. So we'll probably keep coming back to that list and add these questions.
And to add on that, on the list, something that would be important to write would be your expectations.
Yes.
What are your expectations for this appointment, for the treatment? And examples of questions could be, what are the side effects of my medication? What symptoms should I look for? And in terms of symptoms, because I say the word symptom, but how the person is functional in day-to-day life, like can they eat by themselves? Can they go to the grocery store, or this is too difficult? Are they able to manage some money, or it's too hard? So
are they waking up and getting out of bed by themselves? Do you have to set 7 alarms? Do you have to go and, like knock on the bedroom door 20 times so someone moves? Yeah. Are they coming home too late? Are they
exactly?
Are there the behaviors that we only see?
Habits, routine. If I was a caregiver of a person going through the emergency room, and I was involved in the care to this extent, I would definitely try to see the doctor. I would tell the nurse, please have the doctor call me. This is my phone number. This is how you can reach me. I'm here after 5 p.m. every day. I would like to talk to the doctor. Can you call me? Can we set a meeting? Because when the family members ask for this, I always make sure to call them back, and I always try to contact them.
At the Jewish General Hospital, there's a new implementation of what we call Swedish systematic. It's really a checklist for what happens with all the patients as they arrive in emergency and as they get on the ward and up until they're discharged. And in that Swedish systematic, the treatment team is supposed to reach out to a family member, given that the patient has authorized that the family member be approached. So that's the caveat in that, and that has to happen. It's supposed to happen within the first 3 or so days.
All right, you guys have gone through a lot of good things on my list here. So I'm trying to think of like, maybe we could go through like a basic what steps to expect when approaching going into a doctor's office. Like you guys have talked about an interview, and then you talked about like getting prescriptions and side effects and all that stuff. Like what's the general thing that someone should expect when going into a doctor? Like say I personally have never been to a doctor in Canada. Never. A personal, like a GP. And I have no idea what to expect when I walk in. What should I expect?
So Carole-Anne, our doctor, should be answering that. I don't know why you're looking at me.
Yeah, no, I'm looking at both of you.
So maybe we could divide this question in two things. First, what if the person is hospitalized or in an emergency room and they're going to sleep there for a couple of days? And the other part would be like outpatient, like a walk-in clinic or an outpatient appointment with our psychiatrist, for example. So if the person goes in the emergency room, the doctor, usually like an emergency room doctor, so a doctor who specializes in emergency, all sorts of emergency, like psychiatrist, not psychiatric, but more like physical stuff, and psychiatry as well, but not a psychiatrist. So you will see the patient, make sure the patient is physically stable, like and do what he has to do, and then you will refer him to the psychiatrist. Then the patient will see the psychiatrist, and they will discuss symptoms and medication for very, I would say the word acute, like for the symptoms that are present now. How can we help the patient feel better now? So this is, I would say, very quickly for emergency room. Okay. If it's for an outpatient clinic, it would be more, first of all, the patient needs to take an appointment. Sometimes I know it can be very hard, and you do have to call a lot. You do have to know where to call. I guess if people are completely lost with this, I would try to call a hospital, and
811?
They have.
Can 811 help with that?
811 will probably help, and if you just call, for example, the Jewish, at some point in the numeric choices, you will talk to someone like a telephonist, and they will direct you. So you might have to do a lot of steps to figure out how to take an appointment. But I would try to, when you meet the doctor, I would try to make sure to know how to contact them the first time, because I know sometimes this can be very hard. Like I don't know how to reach my doctor. How do I take an appointment? What's the phone number? And then once the appointment is taken, the patient can go with a family member, which is always good, because when we're two people, it's easier to understand and remember things. And then prepare. So the first thing I would do is look at the list that the person prepared, because this is the important things that we need to discuss. This is the concerns that you need an answer from. And in each appointment, there's a part for medication. And if you have questions about this, I think it needs to be covered in every appointment. Like if you need new prescriptions, this is important, because then it might be long before the next appointment to have another prescription. So if you're almost close to the end of your renewals, this needs to be taken care of. And there was one more thing I wanted to say, but I forgot. It's going to come back.
It's all right. It'll come back. We actually have a question from Gilles. It's how to act with someone who is suffering of schizophrenia and they need help, but they're rejecting you most of the time. So maybe, Lynn, you could field this one a little bit?
When it's probably the biggest problem, and Jill, you hit the nail on the head with that one. Someone that, a family member or someone that you know, a friend who's suffering but doesn't recognize that they are suffering. And that is actually a symptom of schizophrenia. The fancy name for it is anosognosia. They have no insight into sick. Recognizing that they have no insight is part of accepting what is going on with them. So you wouldn't want to necessarily argue with them, and just argue with them and drag them to the hospital or the doctor is not going to be helpful. But you can agree that maybe they want to feel better. Even though they don't think that they need help, maybe they want to feel better, and maybe you can, by having that agreement, you can partner. There's actually a book that uses that. Here you're telling me that you're listening with someone. So there's a communication method that we teach here at AMI called LEAP. It comes from a book by Dr. Xavier Amador called I'm Not Sick, I Don't Need Your Help. And all these links, by the way, they should be up on our website somewhere. And the quick part about it is LEAP is the communication method is called LEAP. Listen, empathize, agree, and partner. So you're listening, you can empathize and say, I know you're frustrated, or I know you're not, some of your symptoms are happening, but you don't agree with me. Maybe can we get you to agree, and then we can partner on the going to the doctor. If you want more help on that, please, Mark, you want to put the phone
put up
number
our phone number.
Sure.
It's
and
right here.
It's right over
Oh,
my head, I think.
it'll be right here in a second.
There you
You
go.
You can call us at 514-486-1448.
And maybe you can get some more help on it.
Yeah.
But that's a quick answer, and there really is no quick answer.
There is also a lot of resources at our website, AMI-Quebec.org. I highly encourage everyone to check that out. Even if you're not sure, you might have some questions to answers to questions that you didn't know you had.
Jill, you write that he's rejecting you most of the time, which says to me, oh my goodness, can you get him on a good day?
Yeah.
And really work for that good day? And then maybe you can work with him.
Yeah.
You have anything else to add?
I guess if you know that the person is in danger, or if there's a risk, 911. Yeah.
If they are a danger to themselves or others, and you are considered other, don't forget yourself if you are thinking that you are in danger at all.
So that kind of actually is hopefully, Jill, that answers your question as best as we can. If you have anything else you want us to follow up with, feel free to ask and we'll continue the dialogue. In the meantime, that kind of gets to one of the next questions I had that I thought we could get to is, so there's the times where people can be at a risk to themselves, but then there's also, or others, but then there's also when people are just in crisis. Can you give any insight on how someone can maybe talk with their doctor, even though they're in crisis? Like, if we talk about it now, maybe it'll be in their mind then.
Yeah.
Or like, how do doctors work with someone who's in crisis, or family peer support workers? Like, how does the system help people who are in crisis is a good way of maybe phrasing that.
Yeah. Okay. So I'm sure you will have a lot to say since you work in an emergency room. But first of all, for a person in crisis, emergency rooms in Quebec. So I did my medical school in Montreal, but I assume it's the same thing for the whole province. For a person in crisis, emergency room is always good because it's open 24/7, and people in the emergency room will have the knowledge to help you and make sure the crisis make sure they will refer you actually to the right place. If it is psychiatry or if it's a family doctor, etc., like they will refer you. This is one idea. The other one is, I know in Montreal, every neighborhood has a crisis center. A crisis center is like a house and a phone line at the same time. So there are people answering the phone 24/7 in crisis centers. The ones I know, there's someone 24/7, and this person is available to talk and give information, give help, listening for any type of crisis. Very severe anxiety, suicidal ideas, etc. You can also go and sleep in a crisis center. If you cannot sleep in your home, you can also go there and sleep. And every neighborhood has their crisis center. And when I meet people in the emergency room or in the hospital or in the office, I always give the phone number of the crisis center closest to their home, and I tell them to call the crisis center when they feel good. That way they can make the first contact with the crisis center, and it's easy because they feel good, and they can receive information about how the crisis center can help them. They give their name, so they have like a file open. So when the crisis comes, we already have like the phone number in our cell phone, or we already have the paper and we already called. So it's easier when things are not going well. And I would say crisis, like suicidal thoughts or thoughts of death, wanting to die, the thing to do would be go to an emergency room. They have resources to help, and they have good teams for this.
Yeah, and what I really love, Carole-Anne, your answer is perfect. Try and plan for it. Try and know what you can do in your area, where you can go, and making the connection on a good day is helpful. For family members especially, it's much easier because hopefully most of your days are good days, even though you're taking care of somebody else. So you can have a plan of action that you just implement when that crisis hits. That's a great plan, and I will put in a plug for Suicide Action Montreal. So even on your way, if you don't know how to talk with your loved one who's having suicide ideations or is talking about death and is frightening you, and you want to get them to the hospital, you just call Suicide Action Montreal, and I'm sure, I don't know, Mark, if you can find us, he's on it. He's looking
Mark,
for
if you
the
can get us a number,
number.
you might even be able to make a little new pop-up for us there.
Yes.
With the text box.
So Suicide Action Montreal will answer the phone 24/7 and answer your questions. What do I say? This is what's going on. What do I say? How do I say it? What do I do? And I know
There we go.
firsthand it's there.
Here, just right
There
here.
you go. suicideactionmontreal.org. But there's a phone number.
There's a phone
Also,
number.
I know of a family member who, when this happened to this family member, I suggested they call Suicide Action Montreal, and the family member called on their way to collect the loved one.
Oh, okay.
And before they went there, they got direction. What do I say? How do I talk with them? What do I do? And they were told the automatic things are get them on the phone, make a contract with them not to hang up the phone until you get there, make them promise. Stay there on the phone, make them promise not to move, make sure they're in a safe place, And there you go.
So it's 1-866, just in case, 277-3553. This is a new system for us. We're using this program, and you have all these little things here and down here. It's pretty neat. We get to like tell you things in over here. Oh, sorry, over here. It says this is AMI-Quebec. That's who we are. So you know.
So we're not really there. We're just virtually here.
Yeah, they're both superimposed here. This is a green screen, and at one point, Mark could even like cut us, and we can like get out of the screen, but he doesn't know how to do. We don't really know how to do that yet. We're learning this technology, but we're trying to make this like also not have to be a heavy conversation and like be a little bit more, you know, just to be having a conversation. So
I have one more
oh
thing
yeah,
to
you have
say.
one more
So
thing to
this
say.
is a lot of phone numbers.
Yeah.
Crisis can be all sorts of things.
Right.
And 911
Yeah.
is also
911 is the first one.
yeah.
That's the easiest one to remember.
And exactly. So if in case of emergencies when we forget phone numbers, 911.
Yeah.
And for sure, if someone comes to an outpatient appointment in crisis, at the beginning we said like have a list, concerns, medication, etc. If the person comes in crisis to an outpatient appointment, a walk-in clinic, we will take care of the crisis.
Don't worry about having a list, I guess is what Carole-Anne said.
Yeah, that's it.
If you're in crisis,
That's
Just get there, help
911,
yourself.
get help,
Yes.
Yeah.
period. And this is only a discussion of if you have a good day.
Yeah, exactly. Right.
So I want to get back to like what to bring to a doctor's office. We have this list with all these things that we've talked about, your medications. I saw somewhere online that someone said you should bring all your medications in front of you with the things so that way the doctor can see it. Is that really necessary, or is a list with like what it is and how much you take and how often that should be good enough?
So if the patient comes with all the medication, I do look at them.
Okay.
And sometimes it's helpful to know how many pills it's in the box, how
Okay.
many pills do you have left, how many did you take, etc. So if the person brings all the bag, I will go through all of them.
Okay.
It's good to have a list, and the way to have a list of our medication is going to the pharmacy where we buy the medication and ask the pharmacist to print it for us.
Wow.
Yeah,
I didn't even know you could do that.
And it comes in you can do that, and it comes in a small paper that you can like fold and put in your wallet.
Perfect.
With your Medicare card.
Yeah,
Oh,
so
with
you
your
always
Medicare
have
card.
it, and print it often because medication changes, so we need like
Okay.
an up-to-date list.
Okay.
If the person forgets, it's not the end of the world, because now we have the computer and we like doctors, some nurses, we do have like a USB key with confidential information and passwords, and the list of medication is supposed to be on this USB key, so I will know where to find the medication, but the list from the pharmacy is more up to date than the one on the computer.
Okay.
It's more precise.
What about a pen and paper? Like, say you get
Yes.
to the doctor's office and you're like, oh wait, they're telling me all this information. How do you keep track of that? Pen and paper? Is that the easiest way?
A booklet
Booklet?
for all your appointments, and you could write the date and one page per appointment. That way you always have it in your booklet, and the information is in your booklet.
I'm a pretty technological guy. Technology is like, I try to use it whenever possible because I never have paper and pen. Right now, I'm doing this thing and I have no pen. And I realized I didn't have a pen, so even if I came up with questions, I wouldn't be able to write them down. So one of the things that I read online was to record your conversation with your doctor. What do you think about that?
Yeah, so I don't know what is the law in Quebec about recording a doctor appointment. If a patient asks me, can I record the appointment because I want to remember all the information you say, I will probably say that it's better to not record the whole appointment because sometimes it can be long, and a lot of the time the doctor asks a lot of questions, and the information that the patient really needs is a small part of all the questions and assessment. So if this is a concern for the patient, I will make sure to make time in the appointment to allow the patient to write what he needs to write, or me write it and give a paper to the patient, like the phone numbers. So I would say if not everyone does that, ask, like, I have trouble remembering phone numbers and everything, we have to write it down. Can we take 5 minutes and write like the 3 things I need to remember from this appointment? Because it's important.
I want Carole-Anne as my doctor. because this is what exactly I was going to ask you, if doctors accept writing it. I've actually suggested to family members that yes, you want to go, if you are able to go with your loved one to an appointment, then taking notes is the best way. And if you're unsure of some of the technical words, maybe you're unsure of how to spell a name of medication, for sure is the most complicated, and because you might want to look it up after. So you can ask the doctor or the nurse to write it down for you. And that's often helpful, and even asking them to write, my family member might want to know some things. What can I share with them? Maybe as a patient you can say, I didn't bring a pen and paper, can you write it down for me?
So this is actually a good segue into my next question. Carole-Anne and I talked about this a little bit before we started here, was a lot of times people will take their treatment into their own hands and do things that may or may not actually be helping in the process and in their healing and in their lives. How do you feel about patients doing that? And like, patients should be clear on telling you these things, right? You want to explain why? Maybe like, say I have been drinking hibiscus tea every single day because I'm convinced that is what's keeping me level-headed today.
Yeah. So it's important to tell your doctor if you change your diet, if you take new herbal remedies, or if you started a new treatment like a chiropractor, acupuncture, etc. Because some of them, not all, might have interactions with the medications that the doctor is prescribing you. So he needs to know. Also, if you have any questions like how this can help me, how this cannot help, most of the time the doctor is going to have an answer, and if he doesn't, maybe he knows where to refer you. And this comes a lot with cannabis, since now it's legal and they had the stores. Mm-hmm. So if you take cannabis and it helps, you find it helps your symptoms, this would be very important to tell the doctor, because sometimes, like, what the patient feels when they take any sort of drugs or herbal remedies or anything else can affect in a negative way without the patient knowing. Mm-hmm. So if you tell the doctor, at least we can advise you on things that might be good, things that might be dangerous, how it can be dangerous, and that's it. Yeah.
And what I would add to that, and I'm sure you're going to agree, especially in the case of cannabis, or it's a legal drug, it's okay. But it would be important for the doctors to know that, especially if you're taking other medications that the doctor's prescribing, because there are counter-indications with certain legal
That's it, like alcohol
drugs,
too.
Alcohol. We know we get the do not drive or use heavy machinery with alcohol, but there are other interactions that are very important, not just emotionally or mentally for our mental wellness, but also physically, that can affect your physical health with all of these things that we put into our bodies.
I think one thing I feel obliged to add too is that it's not only legal substances that people are taking, and you should tell your doctor about illegal substances that you may or may not be taking because it's important. You have a
Yes.
patient confidentiality thing where you're not going to tell the police that someone's doing heroin,
Exactly.
right? So it's important to make sure that you're telling your doctor these things, because illegal substances can and do often.
Yes.
Yeah.
Yeah, so that's exactly it. All drugs, cannabis included, it can definitely cause symptoms. It can worsen mental illness as well, and there's no medical reason to use cannabis for mental health. So this is an important discussion to have with the doctor, because and also if this is a problem, we have resources to give patients if they want help to not take substances.
If they don't want to take it. But I think one thing is, yes, I agree with Carole-Anne. Yeah, we don't want them to take it. However, don't be afraid to tell your doctor.
No, exactly.
Because your health is most important. So if you disclose that you're taking even illegal drugs, it's okay. Your doctor will not charge you criminally, will not get you in trouble with the law, will just try and help you get healthy.
Exactly. The reason why it's important for doctors to know is really to help the patient be healthy and having a healthy routine. And this has a lot to do with education and knowing. Maybe not everyone, like cannabis is legal, not everyone knows how bad it can be for them or things like that. So it's not in a punitive way that we need to know this information, not at all. It's really to help and improve health. Yeah.
So what kind of questions should I be asking my doctor? I know we've talked about this a lot. One of the things I read was making sure you're asking open-ended questions. So that would be like asking questions that aren't just like yes or no answers, right? That you want people to ask you questions where you actually have to like elaborate a bit more, I think, is something that I've read that is a good way to prepare for a doctor's appointment. If you have a question, make sure it can't be answered with yes. Okay, well, you want them to tell you why yes. So let's say you've got your doctor's appointment, you've got your list of medications, you found out what the side effects are, what if it can conflict with other medications, and you're about to walk out the door. How do you get a follow-up appointment, or do you need a follow-up appointment, or this is like a big thing, right? Like, what do I do now? I'm going home with this 18 pieces of paper that tell me what I need to do. How do I contact a specialist? All this, how do you do all of that?
Yeah.
I think we should go back to that, and on your list of questions, put it at the bottom of your page before you even write your list of questions.
Oh yeah.
Ask yes, because then you won't forget it.
Mm-hmm.
Put it at the bottom of the page before you start. Start with, how do I follow up? How do I reach you if I have a question? What do I do next?
But when is the next appointment?
Yeah.
If you could book the next appointment while you're there, that would be the most ideal situation. How can I reach you? Where do I call in times of crisis? How does it work for medication? I guess things to know, maybe examples of questions would be side effects of medication, interactions between medication, what symptoms should I look for, when should I come back, when should I come back earlier? For example, if the next appointment is in 3 months, but there must be indications where we must need sooner. What if 3 months is too late? What is so important we need to meet earlier than 3 months? Symptoms. What symptoms to look for? What are the symptoms of what is my diagnosis? What is the diagnosis? What are the symptoms? How can I get better? What will make the symptoms worse?
Is there anybody else that can help me?
Okay.
Oh, okay, that's actually a good point. Is there anybody else that can help me? Something that we brought up when we were discussing this earlier was community resources. And if you have community resources that you're regularly visiting, it's good to tell your doctor about that. Carole-Anne mentioned, I mean, she can elaborate on it a little bit more, why it's a good idea to tell your doctor if you're going to a community center or somewhere in the community that's helping you with your treatment.
So it came during one of my readings about this topic. Someone said if you have a nice resource to share it with your doctor so you can tell other people.
Okay.
And that's true, because we might not be aware of every single resources in the community or how they work and how they help. So if something really helps you, please share it with us. We will be happy to know this new information and tell someone else.
And that actually brings me to a comment that I wanted to make sure that I said today. And that's that often family members feel that if they don't get a doctor like Carole-Anne, and it's difficult to speak with their loved one's psychiatrist or psychologist or whatever, their treatment team. And sometimes it happens that it's difficult. So one thing, yes, to do is really prepare your list so that when you do catch up with them, you are not taking an exorbitant amount of time, that you take the time that you need and you deserve, and everybody deserves to be heard, even a family member. But also to remember how to speak to that part of the treatment team. So what I mean by that is, before you speak to that member of the treatment team, you might be angry that it took 3 or 4 days or weeks or I don't know how long, and you might be frustrated that you called X number of times and it took you how many times to do it. So you might already be angry that it's taking you this long. And what the biggest suggestion is to hold that anger, take it out on, and I tell clients at AMI-Quebec all the time, take it out on me. I'm okay, I have big shoulders, I'll listen to you. Never take it out on your loved one's medical treatment or treatment team. Remember that really that treatment team is there for your loved one. And what you might be feeling might be correct, and that's okay. It's your feeling, and you own it, and that's okay, and that's good. But to come to a treatment team member, we have to suck it up and smile and ask politely, and remember that treatment team member might have gone through a horrific event with another patient 5 minutes before they speak to us, or just might not be. Whatever it is that helps you to keep yourself calm and direct.
And maybe I read online someone was suggesting to show the list to the doctor, or print a copy to the doctor, so we can follow at the same time, and bring it early. Like, I have a list of things we need to talk about today.
I have my list of questions, and show it to them. Yeah. Yes, print it out, give it to them, and say,
the earlier the appointment, the earlier, the more time we have to discuss it.
You might even, as a family member, you might even be able to write your questions and ask your loved one to bring it, so you don't have to necessarily speak with the doctor, but make sure that, hey, when you go to the appointment, can you bring these 3 questions I'm concerned about for your safety, as if.
So Mark has a good question here. I'm not sure where the question came from, or if it's just Mark. It's from Mark. So if you're unsure of what a doctor tells you, how do you get a second opinion? I had this situation come up recently, and I had no idea. I still don't even know how to do that. I have no idea if you're even allowed to get a second opinion in our system. Like,
You are.
how?
I'm not sure, but I would ask my doctor, can I get a second opinion? If a patient asks me this, I will refer him to a colleague.
Okay, so referrals is what you need then.
Referrals. You
Okay.
need a referral to see another specialist.
Okay.
Maybe you could go to a walk-in clinic too.
To get
see
that
if
referral or to get that opinion or?
both. If the
Both,
family
okay.
doctor is good with the presenting situation, the family doctor can definitely give you an opinion.
Mhm.
Or they can refer to another hospital, another specialist. Yeah.
I only ask that because a lot of people don't have family doctors, so they're going to see
All right. Yeah.
you're walking into a walk-in clinic, and then they tell you this, and you're like, well, that doesn't make sense.
I want to go back to that though. When you're going to a walk-in clinic, do people know that the CLSC is really your walk-in clinic? That's your number one walk-in clinic. That is your, they are what we call now guichet d'accès. So that is the first line where you can go and ask to have a GP, a general practitioner, where you can go and say, I need help. I would like to see maybe a social worker or a therapist, or I'm not sure if I need a psychiatrist, but any of those, and the social worker or the guichet access will help you get the appointment to help you make that decision.
In CLSCs, there's such thing called urgence psychosociale.
Yes.
So you can just walk in a CLSC in an emergency situation related to, I don't know, I would say like housing, conflicts, probably like also substance abuse, like drugs, and just walk in a CLSC and receive help with this.
Is this true of all CLSCs? Because I know that when I needed to see, I don't have a GP, and when I needed to see a doctor for a treatment, I went to the Benny CLSC, and they just handed me a piece of paper with a list of walk-in clinics.
Right.
And they told me to just buy. They
So-
said that if you don't have a doctor here, this is only for doctors. Like, I had
Some
to call
CLS
walk-in clinics.
Some in Montreal, I don't know for the rest of Quebec. In Montreal, some family medicine clinics, they just see patients from their own family doctors. So the family doctors who works in this clinic, they have like, each of them have like hundreds of patients, and they just see those patients. Even for walk-in. So if you don't have a family doctor, you can go there because you're not a patient of one of the doctors who works there.
Oh,
But
okay.
there are some clinics that take patients who don't have a family doctor. There's some CLSCs with walk-in clinics who take patients who have no family doctor.
So don't go to Benny Farm expecting to walk in and see a doctor.
A doctor, no.
Yeah, or even anybody. They didn't have anybody who could see me. I mean, I don't know about all their services, but when I needed to see a doctor or a nurse.
They need to, well, maybe not a doctor or nurse, but they have social workers, therapists. And
Okay, that's good to know then. So not everything,
they do.
but
So you can, maybe I'm old-fashioned, call first or check
Yeah.
online. I usually check online and then make the phone call.
Yeah. Oh, I heard Bonjour Santé. I think they have a phone number where they can book you an appointment in a
is
clinic.
that's not 811?
It's not 811, it's
Oh.
different.
Okay.
But I think you might need to pay for this.
Oh yeah,
I'm
you have to
not
pay to
sure.
get your appointment, and it's like I think it's like $15 or $25 or something like that.
Okay,
yeah.
so it's not free.
It's not free, but they'll book you an appointment. So
Yes.
if you don't have the energy or time, but you have $25, it's a solution. All right,
Yeah,
so
it's different.
we're still live. I have no idea how many people are listening or following along. I can't see that number on our screen. But either way, is there anything else? Like, if I've gone through my entire list here, or we have gone through my entire list here. I haven't done anything. Is there anything else that either of you would like to say or bring up? If there's anyone from out there, if you have any questions, this is the perfect opportunity to ask.
I would just go and say that when you want to talk with your health professionals, there was an acronym, and I always find it helpful to follow the acronym that I found, and it's the acronym is very apropos. It's PREPARE, and where P stands for plan, R stands for report, which is plan is make your list, report is report your symptoms, report what's going on. E is for exchange information, so have the discussion and ask the questions and listen to the answers. The next P is for participate, do what you're asked to do, follow the plan, talk with your doctor about different ways of handling what's going on. A is agree, and make sure that you and your doctor agree on it, and that goes back to what we're talking about, legal and non and illegal drugs. It's okay to agree that you're doing stuff. You have to talk all about it. And R is repeat, so you can go back and do it all over again, and talk to your doctor, have a conversation, figure out your questions.
And it's okay to repeat, because when we go to the doctor, it's a lot of information. Sometimes it's difficult to hear, it's difficult to understand and remember. So it's okay to repeat, it's okay to ask questions. There is no bad question. If you don't understand the word we're saying, please say it. We will say the sentence differently, because if you don't tell us, we don't know. And I think the most important thing after a doctor appointment is your concerns and questions answered, because there's no point of having an appointment if you don't understand what's going on, what you need to do, if you still feel anxious because all your fears were not answered. So it's really important. So it's okay to ask questions, make the doctor repeat, and be persistent. As family members, be persistent. I want to talk to the doctor. This is my phone number. It might be hard, but it's definitely feasible, and
persistence.
Yeah.
It pays off. Persistence.
Yes.
Polite persistence.
Polite.
Yes.
That's important.
Polite persistence.
A very important part is not to be rude. When I think of all of this, like if you're gonna have a discussion with your healthcare provider, you have to try to keep our emotions under control as much as possible, and not be rude and
Although at the same time, we have to remember that there is a place to make complaints, and there is a way to make a complaint, and it's okay to complain appropriately, politely, and with the right process. But in this instance, we were talking about how to communicate.
How to communicate.
With the
there's
team.
one point.
One point. What point?
The chart.
The chart.
Patient have the right to have.
The records.
Yes.
Okay.
Records.
So we forgot about this.
Yes.
This is good. So one of the questions that came up was that I saw online was your medical records. Like this is your history. This is your information. How do you see that? Do you have the right to see that? Does a family member have the right to request that information? How does that work? Medical records. Who knows?
I'm not sure for family members, but patients have the right to see the medical records, the notes, the consultation, the lab tests. More than a right, like they own it. It's there, yes. The way to have access to it is through medical archives.
Okay.
It's a place where you could go in the hospital. They usually have signs like archives, and you just follow. Or by phone, they probably have like an extension, and there might be a small fee for the paper they will use to print it.
At the Jewish General Hospital, it's medical records is what the sign is. It's okay. So just
it's different.
It might be different in your hospital, in your place. It is it is the patient's right. Family members I think patients must sign off an authorization that a family member is allowed to collect my records for me, if that's what happens. But and I remember being told that yes, we should. It's not a right. It's your right. It's not a privilege. It's actually really should be our responsibility to double check that those records are correct, because mistakes happen everywhere.
So just to clarify this, if I have no GP and I don't regularly go to the ER, or say I go to 2 different ERs, I would need to go to each of those different hospitals or each
Yes.
walk-in
Yes.
clinic to accumulate all of
Yes.
those records in one place. Is that a good idea for people to do? Like you're saying, responsibility. So say I've been to one walk-in clinic for a bruised rib, and then I went to another walk-in clinic because I thought I broke my thumb, and then I have to go to the hospital later that may have interactions with both of these things. I should have a copy of these records to bring with me.
I think in Quebec the hospitals can speak to each
Yes.
other
Oh,
about
the hospitals
about-
can.
Yes.
Okay, but what about walk-in clinics? Can they request those records from walk-in clinics?
So
Some hospitals.
Some hospitals. Okay.
when I, for example, if I meet you,
Yeah.
I will ask, have you ever had any surgeries? Have
Yeah.
you ever been hospitalized in the past?
Yeah.
Like, have you seen a psychiatrist? What was the diagnosis? And you would tell me.
Mhm.
I would not need you would not need to bring me the paper
Okay.
from when you went to the walk-in clinic because you had a broken rib.
Okay. Doesn't matter.
Or
It's
it
unrelated.
it might be important. If
Yeah.
it is important, I will ask you to sign a paper. So I ask the walk-in
Oh,
clinic
okay.
to fax me the papers.
Okay.
So you don't have to get stressed about having your complete record from every hospitals.
Okay.
I would say it's really if you are interested in reading what's in
Okay.
it, if there's errors and you want to see, if this is something that interests you. If you have completely no interest in going over all those papers and it seems too complicated, and you're not sure it's
Yeah.
worth it, it's completely fine to
Okay.
not have it. If you have questions, next time you go to the doctor, ask. I
Yeah.
went to the hospital, they have the records of this. I wonder what this specialist said 2 years ago.
Okay.
I
I
can
don't
look.
remember exactly.
Yeah. Okay.
Can I bring up one thing of it's actually there were 4 points of what family members can do and how they can be involved in the patient's care in terms of communication with the treatment team and how a family helps. And of course we've spoken about them, but particularly exploring the medical treatment options, medication and treatment options. So a family member can talk to the patient, talk with the doctor, and that might be the questions that they want to ask about is medication and treatment options. The family member may or may not be able to attend doctor's visits depending on the wishes of the loved one. The family member may be able to or not be able to, but talk about at least participating in the treatment decisions. So help your loved one with those decisions. Help them come up with questions and concerns and walk them through it. And of course the implication of being available and being part of the follow-up. So helping your loved one get to the appointments that are coming, making sure that they take the medication as part of their follow-up and then get to the appointments. So those are just particulars for family members.
It makes me think we underestimate the phone call. I've seen appointments where the family member for 20 minutes spoke over the phone on a speakerphone. So this is definitely an option.
Yep.
Not necessarily. I know sometimes when people are in emergency for family members, it can be long to wait in the middle of the night. Phone, ask the doctor to call them, or call the next morning. You can talk to the nurse, and the nurse will report this to the doctor. A phone call, we underestimate
Technology.
how helpful it can be.
Great. Well, thank you, Carole-Anne, and thank you, Lynn, for participating in this discussion. We talked about a lot of different things. If you have any questions, Mark's going to put up our phone number right here, 514-486-1448, and our website, AMI-Quebec.org. Please call us if you have any questions, if you have concerns. We are a resource in Montreal, and we will try to guide you into the right direction. Our next topic will be coming up in a month, where we'll be talking about schizophrenia, I believe. So, yeah, we'll see you then.
Hopefully Jill will be there.
Someone will be there. I'm not actually sure who's going to be there.
No, I meant Jill, who asked us the question.
Oh, Jill. Yeah, Jill, you can tune in. Yes. Bye-bye.